The CDC says that if you're in that group who may, rather than should, get a booster, that you should weigh your individual risks and benefits. So we know that the risk of the COVID vaccine is extremely low, but what is the potential benefit of getting it if you're otherwise low risk of getting COVID, and what is your risk should you get COVID? So it really comes down to four things. So what is your risk of exposure? Are you in a job or a position or other situation where you're around a lot of other people that you don't know whether they could be carrying COVID or not? They may or may not be wearing masks. Versus, are you someone that's able to work mostly from home, or that you've maintained your social bubble so that you're not exposed to a lot of other people? The second thing is, what is your risk of infection should you be exposed? And that comes down to how long has it been since you were initially vaccinated, and the longer it's been, the more likely it is that you have less protection due to waning immunity. The third thing is, if you are infected, what's your risk of severe disease? So do you have underlying comorbidities? Are you older as opposed to younger? Are you immune compromised? Those are all things that you would factor in. And then the last thing, what other potential impacts might COVID have if you get it, even if you only end up with a mild case? Being out of work for a minimum of 10 days might be some more problematic for some than others. What is your risk of exposing other people? Maybe you live with young children who are not vaccinated or cannot be vaccinated. Maybe you live with people that are immune compromised or have other medical conditions that if you end up exposing them, they could get really sick. So all four of those things are things you want to consider when you decide whether or not to get a booster.